Hello, massage nerds. Today I'm going to be talking about thoracic outlet syndrome and the brachial plexus. The brachial plexus is a freeway of nerves. There's 5 nerves that come out from the cervicals and go down that feed. Brachial means the arm, so that feed the arm. So it's let me tell you which ones they are: the axillary nerve, the median nerve, the muscular cutaneous nerve, the radial nerve, and the ulnar nerve. They all go through the neck. Now, a lot of times they get trapped between the scalenes. This is the scalenes anterior, scalenes medius, and the pec minor, because they come out from here from the cervicals, go underneath the clavicle, and then go in and underneath also the pec minor. The pec minor is known as a nerve entrapper, okay? And so, are the scalenes. The scalenes assist with when you breathe. They lift up your rib cage, and a lot of times if they get tight, they cause a lot of pain on people. Some of the symptoms of the thoracic outlet syndrome are numbness, tingling, coldness down the arm, weakness. So and it's usually caused by repetitive motion. People that work with their arms out, like hairdressers. I've seen this a lot with people that wear heavy bags. Okay, I know a lot of my clients, they come in with this big old heavy bag and it's on their shoulder. So this puts pressure right on the clavicle coming down, and it puts pressure on the nerve. So if your clients have any of these symptoms or signs, there's 3 tests that you can do. And we're going to include the links below, which is the Rose test, the Adson's test, and the Wright's test. Those 3 tests you can do before, obviously, with a good medical history and asking them if they have any numbness or tingling. And they're different. If it's numbness in the pinky, that will be the ulnar nerve. If it's numbness in, the thumb or tingling or anything, that would be the radial nerve. The median nerve, remember, goes through the carpal tunnel. Oh, I want to talk about this, that a lot of times people think that it could be the carpal tunnel syndrome. However, sometimes it starts from the neck. Sometimes it starts from the cervicals, from this nerve being pinched, and then it goes down the arm. So make sure that you do some of those tests. And remember, we don't diagnose. A lot of times clients already come with a diagnosis. So our job is just to, to treat and release some of this compression. So I'm going to show you a few techniques. So people that carry heavy bags, their laptop, people that work, with extended arms, if they feel any, numbness or tingling, make sure you do these techniques. So first, remember, I like to do some myofascial release without any oil. So I'm going to move over here to this side. And one of the first things that you want to do is start addressing the scalenes. So I'm going to move his head in just a little bit of rotation. Remember that the carotid artery, subclavian artery go through here, and the jugular vein. So if you feel a pulse, please stay off of it. Anytime you work here, you want to, do light work, not something, where you do deep tissue. And remember the little triangle. This is a danger site right here. I have another video about the 2 triangles on the anterior and the posterior. So make sure that you don't put pressure right here in this little triangle. So here are the scalenes. And, one of the things that I like to do is just with 2 fingers, the pressure of 2 fingers. And if you have, a larger person, you can use a soft fist, to go up and down, up, inferior, superior to the origins. The origins start from the 3rd, 4th, 5th, cervical, transverse from the cervicals. And this is the medius, which starts from the 2nd, 3rd, 4th, 5th, and 6th cervicals. So you can do even I like to do like just some movement here. Get it to start releasing. I like to do some cross fiber with my thumb. Cross fiber. And you always want to make sure and check with your client. Look at their facial expressions, because if they do have thoracic outlet syndrome, this might be very painful. One of the things that I like to do is, like, let's say I find a trigger point. Usually there's 3 trigger points for thoracic outlet syndrome. One of them is in the scalene's anterior. Another one is like in the pec minor, and then another one goes into the arm. So make sure you treat all of this area here. So what, like I said, let's say he has a trigger point here. You want to rotate the head. You know, just put a little bit of pressure there and get those fibers to start relaxing. You want to do some cross fiber friction with your fingertips, just cross fiber. This is all I'm doing, using 3 fingers, cross fiber friction. And you can rotate the head a little bit, get some movement here, go all the way down. It goes under, this is the clavicle. We drew the clavicle here. It goes underneath the clavicle and insert right on the first rib. So, you know, you can make sure and go here. I like to use my thumb here, and I like to start with a sternumist. The sternoclavicular joint is very important because that's the only joint that joins the axial skeleton and the sternal and appendicular skeleton. So you want to go all the way from the sternum all the way down the clavicle laterally, 1-inch strips. You also want to work the subclavius, you know, the subclavius right underneath the clavicle, because a lot of times that right there in between, that would trap some of the nerves. So you want to move from medial to lateral, okay? Another one that I like to do is a little bit of a stretch from the opposite side of the table. Just make your strokes, give them a few strokes, and then do some stretching. I'm using my right hand to push down. This is a little bit of traction to decompress some of these muscles and decompress some of that, you know, especially if they've been carrying heavy weight on their shoulder. So I'm cupping at the occiput right here with my hand, and then with my right hand I'm pushing, so I'm separating, trying to create some traction here. You can hold that for a few seconds and then just move up, you know, do some massaging here. You want to release the upper trap too, because a lot of times the upper trap is tight. And also the SCM. Remember, the scalenes are between the SCM. Can you lift your head for me? Okay, right here you can see his SCM, his sternocleidomastoid. Okay, relax. So the scalenes are between the SCM and the trapezius. So this is the area that you're going to work, being very careful. If it feels like a shock, like an electrical shock, then you're on the nerve. So stay off the nerve, and if you feel a pulse, you stay off the pulse. So now that you're done working on the scalenes, you can go, you know, up, you can go down, you can go transverse, across. You can do circles with your fingers. So that's 4 different techniques that you can do around this area. So once you're done with this, now you can move to the pec minor. And the pec minor, okay, if, let's say, this is pressing, putting pressure here, you want to move up. You want to work up, okay, to release some of the pec minor. So one of the things that you do is you start at the origin, and you can put the origin is right here, ribs 3, 4, and 5. Put his arm out. And then while you're pressing on the origins, you're going to ask your client to, supinate and pronate. There you go. That really starts releasing some of that muscle. So this is an active motion. And then I'm going to move up another inch, and he can continue. And then another inch, and he can continue there. Okay, all right. And then you can move. That's one thing that he can do. Another one that you can also do is, like, of course you want to go with the fibers, okay? I can also use my flat palm, or you can use a soft fist. And if you're sitting down, you can also use a forearm. Especially if it's a male, it's okay to use a forearm. You can start from here and just go up. Go up. And have them do that motion again of supination and pronation, or lateral, or internal rotation. Another one that's very important for the pec minor to also is, like, to come here and do some pressure. Find the coracoid process. Remember, the coracoid process is part of the scapula, and it's right here. This is the insertion of the pec minor, and it's also the origin of the biceps, the short head of the biceps. So you want to be careful with this insertion and origin right here. I'm sorry, I don't want to confuse you. It's the origin of the biceps, but it's the insertion of the pec minor. You want to go maybe like right below where the tendon is, not right on the bone. Okay, you don't want to put pressure on the bone. But once you're holding here, what you can also ask your client is to shrug their shoulders. Move their, see how it's stretching? Look, as he's shrugging his shoulders, I'm pushing down on that pec. So that will really help, that will really help. Okay, so another one that you can do is you hold right here at the pec minor, and then you ask your client to do a full circle. This also engages all the pec minor and the muscles here that might be tight. So this is another active motion that he can do. And just 3 or 4 times, depending on how much work that needs to be done. Okay. So it's very important, guys, to address the scalene's anterior, the medius. The posterior is back here, and it doesn't affect the nerves too much, but it's important to work all the muscles. Remember, you have agonist and antagonistic muscles, so you want to make sure and work all the muscles here in this area. And also the SCM. A lot of times the SCM is tight, and it can cause some tightness in the neck. So make sure you're thorough with all of that you're doing, all the work that you're doing. I also want to tell you, since this clavicle a lot of times is, being pushed down. So what you want to do is with both your thumbs or even your fingers, just try to push up on it a little bit. Try to release some of this compression here. You're getting to the subclavius, and you're just trying to push it back up, because if it's being pulled down and putting pressure on the pec, what I'm doing is I'm pushing up medially to lateral. If you can pull it up, or grasp it, if you can do that and just create some motion here, you can do that too. Whatever works. And then, of course, you can end by doing some nice strokes and some more stretches here. Now I'm going to show you sideline, because that's easy, so easy to access the scalenes from the sideline position. Okay, so now that he's in the sideline position, make sure you have a pillow supporting the cervicals, and of course a pillow, between his knees. But this is a perfect way to really get to the scalenes here, guys. Look at this. You can even do some traction, like you pull down on the shoulder and stretch the head, in lateral flexion here. I'm at the occiput. This starts creating a little bit of traction, a little bit of stretching, and you can get to the scalenes perfectly, to the origins right here, guys. This is I love sideline position, because you can really access the muscles better. And if you feel a pulse, you stay off of it, but you can come down 1 inch at a time, just doing some massage here with your fingertips. You can also do cross fiber. It's a lot easier to access the scalenes sideline. And so you want to go, some nice smooth strokes. and some nice stretches. And this is also a great way to access where they go underneath the clavicle. And if you feel a pulse, it's usually around here. Make sure you don't go anterior, because you can also feel a pulse here on the anterior triangle. So even just with one fingertip, you can access how the muscles as they go underneath the clavicle. And here, the pec major kind of falls out of the way. So this is also a great way to access the pectoralis minor. And you can do circular motion, cross fiber. Let me show you one last move. Let me see, relax your arm right here. With this arm, you're going to come up here and hold your arm up. There you go. And you're going to be able to go right here. It relaxes the muscle more, and then you can push down on it. Does that hurt anywhere? No? Okay. Okay, so this is a way that if they support their arm, that it relaxes the muscle a little bit more too, and you can get to some of the trigger points of the scalenes. Remember, trigger points you only hold for no more. Let's say he has a trigger point right here, because that feels tight right there actually. I can hold that up to 20 seconds and just make sure, have him breathe. Have your client breathe while you count up to 20, no more than 20 seconds. You can add, you can address the trigger points from different areas, from the supine position and then the sideline position, and then come back to it if it doesn't release by the third time. But let's say we're done with that. So now he puts his arm back here. And another one that I like to do is I take my knuckles, like this, and I push this with my forearm, and then I go down. And this really lets me get into the scalenes posterior, medius, and anterior. And I'm not putting pressure down on the table like this, okay? I'm going right here in the insertions. A little bit on the neck, but not too much. Remember, this is soft tissue here. So, like I said, this is a sideline. Okay, so I like to end with a little bit of traction here, just really doing a little bit of traction. By now the muscles are warmed up, they're relaxed, and you can just, feel all that tension coming off their shoulders. So you can sideline. It's one of my favorite ways to get to the scalenes, and I hope this helps you to really help somebody with thoracic outlet syndrome. Till the next time, create a great day.